Hope y'all can hear me. The AC is on and we're not turning it off. Okay, so nursing students, I want to give you a little bit of advice or some things to think about while you're in nursing school when you know that you want to get into a specific specialty. So as new grads, you don't necessarily have to go into med-surg and then work your way into a specialty. I know that back in the day, that used to be the thing. Everyone had to get their med-surg experience. Then you can do your ICU, your pediatrics, your NICUs, your PICUs, your trauma, your ER, whatever that you wanted to do, but you had to get that med-surg down pat. You don't necessarily have to do that. There are plenty of places that will hire new grads as specialty. Within a specialty, they have programs available for you, but it is competitive. So I would say, if you know you want to say, let's just talk about ICU. You know you want to get into ICU. We don't necessarily go too deep into that while you're in school. There's not a lot of talk about it, but I would say start doing your research. Look up YouTubers who are ICU nurses, or they were ICU nurses. Look at different medications that you would need to use in the ICU, especially if you have a specific one that you would want to go to, like whether it be cardiac or med-surg ICU or trauma ICU, burn units, things like that. Look up those specific ones and get information about it, especially the drugs, procedures, tests that are done there, assessments that may be specific to certain specialties you want to go into. Start to get that in your mind and look at it. Talk to your professors. If you have professors that they tell you, hey, I had ICU experience, start talking to them. Get chummy with them. I ain't saying you gotta, be a teacher's pet, but just talk to them like, hey, I'm really interested in going into the NICU. Can you give me some advice, some things I can start working on now while I'm in school? Yada, yada, yada. How do you think I can be more competitive once I graduate? Yada, yada, yada. Okay? Now, if you go to a hospital and do your clinicals, if you like that hospital, maybe message or email one of the managers on one of the in the ICU and ask them, hey, I'm a student, I do clinicals here, I really enjoy doing my clinicals here, I would love to maybe shadow an ICU nurse if that is possible, or if you can give me some advice on how I could get started on an ICU unit, in the ICU, coming out of school, some things I should be doing right now. Ask them. My mom always told me, people love to give advice, okay? Now, it's different when you ask for a favor, right? But people love to give their take on something. They love to give their opinion about something, especially if they have an opinion about it. So ask for advice. Just reach out and say, create that thread of communication with people. You never know who can give you the advice that you need, or who can connect you with someone else. Trust me, open your mouth, ask for advice, ask for somebody's point of view on something, or just let people know, this is what I want to do. Tell your instructors, hey, I really want to be a vascular access nurse. So if there's ever opportunity during clinicals where I could do an IV, I could see somebody doing an IV, or I could maybe shadow a vascular access nurse, like, I'm down for whatever, please help me, show me the way. Put yourself out there. You're in clinicals for a reason. Now, yes, there's a certain pattern that they follow with clinicals, but if you know that you want to do something, you're interested, you have to show that initiative. And the best time to do it is while you're in nursing school, while you're still green, while you can still make mistakes, while you don't have that responsibility on your back, right? As a new grad nurse, all that responsibility. Do it while you're in school, and you might discover, hey, I thought I really wanted to become a vascular access nurse, but when I did my maternal health clinicals, I saw the nurse anesthetist putting the epidural in the patient, and I was excited about that. Maybe I want to learn more about that. Talk to them. You see a nurse anesthetist, be like, man, I think it's so cool what you're doing. I would love to become a nurse anesthetist or learn more about it. Do you shadow students? Like, can I shadow with you? Create those connections. It's no different from any other field where it's like, it's not what you know, it's who you know. And nursing is very small. When you're in certain cities and certain areas, especially as you get more into your specialties, it gets smaller and smaller because it's a specialty, and you need to work on your networking skills, okay? And again, they might not be willing to shadow you, but they may give you some advice. They might give you a little nugget of information. Hey, when you go into those interviews, do this. They might ask them, Talk to a nurse in the ICU or on the maternal health unit. When you was in your interview, can you think of some questions they asked you, like some things, Just start talking to them. Man, when I tell you, people love to talk. People love to talk. I'm literally talking to myself in my car, okay? People love to talk. So just be friendly. Be open to hear what someone has to say and get it from anybody. Even the CNA or the tech on the unit, talk to them about it. Like, how is it working here? Like, how do you see, like, with the nurses, what is it like working on this unit? Like, what do you think of it? Start getting information from people. Put yourself out there. And of course, when you're in that class and you're taking that class, really, sometimes, like, teachers won't go super deep into certain specialties, especially like when I did my LPN. When we came to maternal health, we didn't go too deep into it. Like, we learned about oxytocin, the different positions that the baby gonna be in, a different hip, like, what do they call it? Like the hip sizes. Like, there's one like ideal hip size or pelvic size that I forgot. I think it's over the A. Anyways, I can't remember. But there's because I don't do none of that. But the different width and shapes and sizes of a person's pelvis that makes it more conducive for you to be able to give vaginal birth, things like that. We learned very basic things. Oxytocin was a big thing with maternal health. And then like the what is it, paragravida, like the different Latin words to let you know if that person has had a baby before, never had a baby, or it's a second baby, or they lost a baby, blah, blah, blah. So they have those like different terminology. That's all we really knew about maternal health. But they didn't go into great detail. But you, if as someone who wants to go into that specialty, read those chapters front to back. Look over those medications. Like I said, look over certain assessments. Different specialties have different assessments that they do. Different specialties have different diagnostic tests that they do, different blood work that they're looking at. So look at those little things so you can get yourself more acquainted with your specialty that you want to go into. And also, I would say, you might go into it wanting to do ER nursing, right? But you might keep yourself open to other things. Okay, keep yourself open to other specialties. Still, don't just only focus on what you know you want to go into. Still be open to other stuff, because you never know. I had a teacher, she was like, I knew for sure I did not want to do pediatrics. I never ever wanted to do peds ever in my life. She said I was an ER nurse though, and I just started getting all these ped patients, and I'm like, she's like, and before I knew it, I became a peds nurse. Like, I fell in love with it because they're so much better than adults. They're so much better. They're so resilient. They don't complain, and nobody, they didn't put themselves in that position. So I love working with pediatrics. She let herself be open to it, I believe, plus God probably pushed it to her. The universe was pushing her to it. It's the reason why she kept getting those ped patients. So keep yourself open. Talk to people about what you want to do. Ask for advice. Of course, be professional. Okay? Be professional with your professors, with your fellow classmates, at your clinical sites. Remain a professional at all times. Okay? You're not there to be complaining the whole time, to be sitting down doing nothing. Even if it's a clinical, I just going to a little tangent. Even if it's a clinical site, you don't want to be there. You don't want to do any of the work. Be eager, be open, be optimistic, be like a ray of sunshine, okay, at these clinicals. Because a lot of time the professors don't want to be there. The nurses that's working don't want to be there. Like, nobody wants to be there, but be of service. Just show that you have that enthusiasm, okay? You ain't even start working yet. So I think you need to go ahead and have some enthusiasm. You in nursing school for a reason. I say this because some people in clinicals be acting like they do not want to be. You be like, girl, I know you don't want to be here. Nobody wants to be here, okay? Like, we ain't getting no work pay, but we working. We literally paying to be here at this clinical site working. But the teacher be like, hey, anybody, this patient needs to get turned, or this patient needs to get changed. Okay, I'll do it. Jump up. Even the most medial things, jump up and do it. That shows that you have that can do it team player energy about you, and people love that. People love that, trust me. What else can I say about you with your specialties? Yeah, just open your mouth, ask for help, talk to people. Even if there's a teacher that you only saw a few times, go talk to them. Talk to the guidance counselor at the school. Ask them for more advice. Just ask everybody for advice, and use your time while you're in school to the highest ability, because this is the only time where you're going to be this green, you know, this new, this fresh, and you're gonna have way less pressure on you. Of course, you have the pressure of completing your courses, doing in-class, yada yada yada, but when it comes to yourself as a professional, you have way less pressure on you. So be more open to doing things, right? So working as a PCT while you're in school or on your summer break or before you go start doing your prereqs or while you're doing prereqs, working as a PCT on the unit that you want to work on. So working in the ICU, pediatrics, what is it called? Maternal health, any of those things, working there first before you become a nurse is like, I feel like a cheat code to help you to be able to get into these specialties as a new grad nurse or someone who doesn't have experience, because at least you have some type of experience on that unit around these type of patients. Like there's different things that PCTs do depending on what floor they're working on. So it gives you that understanding that's there for you already. And you'll be able to talk to the nurses that's on the unit. You'll be able to see the doctors. You're seeing the actual patients. So you can learn a lot while you're on the unit, as well as if you're working on that unit while you're in nursing school. Maybe you're doing like PRN or something like that. When you graduate, this puts you in a position to be able to easily get onto that unit. Of course, you need to remain professional, come to work on time, keep up with certain things, do your actual job, have a good rapport with people on the unit. Of course, that's going to help you. Like, yeah, come on. Now, that should be a given, but I know some people. Anyhow, doing that is going to give you a foot in the door. So try that out and let me know what you all think. Oh, and also sometimes on these units, you can become a nurse extern too. So they have like nurse residency programs where new grad nurses can go into a residency for a year or whatever on a specialty unit, or they have it where you can be a nurse extern. So you're still in school and maybe you work like one day out the week or a few days out the month while you're in nursing school. And the whole ideal is that you're getting that experience. You're basically shadowing a nurse, being with them, working with them, being around patients, looking at medications, looking at procedures, all these different things. And then when you graduate, you can start working on that unit. So, and you get paid to do it. So that's definitely a good way to get in. That's my advice for you all. If you went into a specialty after nursing school, please give everybody some advice, some pointers, some information down below. Please help everybody out. That's what this channel is about, for us to help each other out and to be positive and open and be real. Now, we be real now, but to be positive and help people out, because I mean, we all still doing the work, right? Or we trying to get into the work, so let's just be positive. But you can be real. I mean, it is what it is. But what was I going to say? Give some people some advice. What specialty do you all want to go to? When I first started as my RN, I really wanted to work in the ED, y'all. Like when I tell you I wanted to work in the ED so bad. I love high energy stuff. I like, you know, what's going on type of thing. And I like the teamwork that an ER would have as far as everybody just gets in and start doing the work. But y'all, I'm tired now. I don't think I want to do that. I like being just chill. Come in, work my 2 days and leave. Because sometimes like the stress of it all is very stressful. I'm learning that my stress tolerance is getting real. I just like to not have to have stuff still in my head when I leave work. At one point I went really heavy into learning about nurse anesthetists. It might still be out there for me in my life. You know, I would have to work in ICU. I'd probably do cardiac ICU, do that for a few years and then decide if I want to be a nurse anesthetist, but that's down the line, y'all. I like the idea of the school. I feel like the schooling would be so cool, like learning physics and just like the math and the science behind it. I think it would be really, really interesting. And y'all know I love school. I really love school. Maybe I just need to become a professor, because I love being just on a college campus. Like I just love the feeling of being at school, sitting down, studying, going to the library and having a study. Like I love it. But I'm tired though. I really don't want to do all that right now. I would have to do quite a few things to become a nurse anesthetist. Like go get my bachelor's degree, get some ICU experience, like all the different things, do some graduate level courses, and then of course apply for a program. And I would have to, you know, get some referrals and all of that. So I don't know if I'm there yet. I don't know if that's what I want to do. But if I do decide to stay in nursing for like another 10, 15, 20 years, I might go ahead and do that nursing esthetist. But I'm gonna let it come to me. I'm gonna let what's next for me come to me. In the meantime, like, comment, and subscribe. Remember, I am your fave nurse B. I love you all. Thank you so much for watching. And also, side note, thank you for all the birthday wishes from you all. Like, oh, so sweet, so sweet. Oh, I love every last one of y'all. I appreciate everybody. And again, thanks for watching. Peace.